I'm Peter Psaltis. I am the Deputy Director of the South Australian Health and Medical Research Institute in Adelaide, also called SAHMRI. Within SAHMRI, I co-lead its largest department, the Lifelong Health Theme, which consists of about 400 scientists and students studying diseases across chronic disease and ageing spectrums. I also lead a program of my own in vascular research, focusing on heart disease and in particular atherosclerotic or vascular disease. I also work as an interventional cardiologist. I am the head of interventional cardiology at the Royal Adelaide Hospital here in Adelaide, and I'm a clinical academic at the University of Adelaide, funded by the Heart Foundation and the NHMRC of Australia. So I was trained in Adelaide as a medical doctor, as a clinician. I did my early clinical training at the Royal Adelaide Hospital, including cardiology. On finishing cardiology, I did a PhD in Adelaide at the University of Adelaide on the ability of stem cells, particularly stem cells from bone marrow, to repair broken hearts in the area of cardiomyopathy. I was the first person to ever inject stem cells into an animal model of non-ischemic heart failure using a special catheter technique. And from that work, I then went and did a 3-year postdoctoral fellowship funded by the NHMRC at the Mayo Clinic in Minnesota. At the Mayo Clinic, I discovered a new type of stem cell in the outer lining or the adventitia of arteries. These stem cells produce macrophages and endothelial cells, and they have a role, we believe, in atherosclerosis, so in the buildup of plaque in arteries. And that body of research has led into some of the work that I have done since moving back to Adelaide. After 3 years at Mayo, I did an interventional fellowship at Monash Hospital, now Victoria Heart Hospital in Melbourne. And then in 2015, I returned to my positions in Adelaide, both here at SAHMRI, the University of Adelaide, and the Royal Adelaide and Queen Elizabeth Hospitals. Since 2015, I've led a group here focusing on different aspects of vascular research, including atherosclerosis, but also other related areas. We focus on trying to identify new drivers or new causes of atherosclerotic vascular disease and heart disease so that we can identify better ways of predicting risk in patients who have that disease, and also, most importantly, better ways of preventing and treating that disease. Atherosclerosis, which is the build-up of cholesterol plaques inside of the arteries of the body. Those plaques narrow the arteries, so they restrict blood flow, but they can also block off to cause tissue damage, for example, a heart attack. Atherosclerotic diseases are the leading causes of death in Australians, particularly through heart disease and stroke. We know that there are some crucial risk factors that contribute to atherosclerosis, for example, high cholesterol, high blood pressure, smoking, diabetes, and a family history. But even accounting for those risk factors, there are other hidden factors that seem to drive risk and cause disease in some patients so that they have worse outcomes, even despite our best practice care, than other patients. My group's really about trying to understand what those new or hidden causal risk factors are so that we can do better at diagnosing and prognosticating in atherosclerotic disease, and then we can develop new treatments. We're focused on ways to intensely lower cholesterol. We have focused on ways to target inflammation, which is another key driver of plaque buildup, and focusing on those stem cells that I described. We've looked at their role in driving the buildup of plaque from the outside of blood vessels in. I also work heavily with engineers, and we are developing new techniques to image plaque inside of arteries with new catheters that we are bioengineering through 3D printing. And we have taken that work from mice to pigs and soon into humans. And with another engineering collaboration, we extensively work in the area of mechanical forces in arteries, looking at new ways to measure, using engineering techniques, shear stress and other forces that cause the buildup of plaque and their complications. My passion is driven directly by my experiences treating patients with heart disease for over 20 years. Heart disease is the leading cause of death, but also morbidity, disability in people in Australia. We know a lot about what causes heart disease. We've got some wonderful evidence-based treatments that continue to improve. But despite our best efforts, there are still people who suffer enormously. People who die unexpectedly of heart attacks and strokes, people who survive heart attacks or strokes but are left with very bad disability and high risk of having repeat or secondary events. It's seeing the impact of heart disease on those people and their families and on society more broadly that really drives my thirst and hunger to find new solutions. And those solutions for new treatment need to be based on a better understanding of the factors that drive heart disease, and in particular in my area of atherosclerosis. I've always been interested in mechanism, so what causes disease to happen, why and how does it happen, and that really underpins the research that I do, which ultimately is about finding better solutions of care and prevention. But it needs, in my case, to be driven by the mechanistic questions, and that forms the fundamental basis of the research we do. I have a family of 4 children, ranging from 21 years of age down to 8. A lot of my time outside of work is spent with the family and with their interests. Beyond that, I've always been a sports-loving person. I have a passion for Australian rules football, one of the local teams here in Adelaide, Port Adelaide, who have followed very closely all my life. I play a lot of tennis and I exercise through the gym and running. More broadly, I've always enjoyed reading, and where I find the time I continue to do that.